Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a September 3rd, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today is 2,092, which is 56 new COVID-19 cases since my report last Monday, August 31st. The total number of COVID-19 deaths remains at 36 in Dubuque County. 8.4 of the over 24,500 people tested in Dubuque County have been positive overall since March, with an overall positivity rate of 8.5%. The 14-day average positivity rate is 7.4%. As of September 2nd, 9 Dubuque County individuals were currently hospitalized in Dubuque County, and 78% of Dubuque County positive cases have recovered to date. The state added 2,331 cases since Monday, August 31st. As of September 3rd, 2020 at 2 p.m., Iowa has a total of 67,151 positive cases. In all, about 1 in 5 Iowans, or over 636,000 people, have been tested. And just over 10% of Iowans tested have been positive, and 49% of the state's positive cases are in the 18 to 40 age group, and more recently, the majority in the 19 to 24 age group. Yesterday's state 14-day average positivity rate was 11%. Deaths reported in the state total 1,135 Iowans. And currently, 323 cases are hospitalized throughout the state, with 51 admitted in the last 24 hours. And finally, about 72% of Iowans have recovered. A couple of newsworthy items to review today. First, you may have heard about the latest White House Task Force report on Iowa and the rest of the country. Several weeks ago, the report declared Iowa as a red zone state, along with Dubuque County and the City of Dubuque declared red zones by having more than 100 new cases per 100,000 population over a week and a test positivity rates greater than 10%. The latest report now puts Iowa in the red zone as a state, citing Iowa as having the highest rate of new cases per 100,000 population in the country and the 5th highest in the country for test positivity rate. On the other hand, the City of Dubuque and Dubuque County went from being a red zone to a yellow zone based on these statistics locally. That's good news for us locally, but even being in the yellow zone does not allow for any relaxation in restrictions or efforts to limit the spread of COVID-19. A lot of travel happens within Iowa, especially since colleges and the 3 major universities started classes a few weeks ago. As I said earlier, this movement and congregation of students has definitely contributed to the state red zone declaration. We know schools opening up are affecting and will continue to affect our local positivity rates. But all of our county schools, colleges, and universities are striving to stay on top of any positive cases, identify them early, and swiftly assure those students or staff are isolating and identifying close contacts promptly. We ask all students and parents to cooperate with our VNA and state contact tracers. You may have to quarantine for 14 days or isolate for 10 days, but that's a small price to pay to assure you won't infect your fellow classmates and teachers, along with helping the schools stay open for in-person classes, sports, and extracurricular activities. The headline news is also out about vaccine distribution beginning November 1st. And yes, our local public health incident management team is gearing up and planning for vaccine administration and distribution with the directive to be ready by early November. We do have prior experience in this model when we distributed vaccine for H1N1 influenza several years ago. It does help that I've been in this job for a long time. This time around, however, the stakes are different. A brand new virus requiring development of an entirely different vaccine, tested at a much faster rate, and being produced in much bigger quantities. The logistics and coordination of this endeavor are somewhat daunting, but as we drill down to the local level and utilize our partnerships with the healthcare community here, we can develop effective vaccination strategies here in Dubuque County. The first doses will be offered to healthcare providers like doctors and nurses and other high-risk populations. Stay tuned as ever-changing plans and vaccine directives come out. So it's hard to believe it's already September and this weekend is Labor Day, signaling the end of summer and the time we start thinking about fall, digging into school, and yet all with a new COVID-19 twist. It's also a time to be thankful for being able to work at your job while showing support and kindness to those who are unemployed due to the pandemic. Take some time this weekend to reset and regroup, enjoy the outdoors while summer is still with us, but all while taking all the precautions we should all be used to, keeping a minimum of 6 feet away from others, especially if you'll be attending any gatherings or events like Coachella Festival tomorrow or school sporting events. Although these events are outside, we still have to be mindful of distancing, wearing masks, and wearing them correctly. Extra hand washing and sanitizing, and not going to events if you have any COVID-19 symptoms or just aren't feeling well in general. Thanks for tuning in today. Have a great Labor Day weekend. We are all in this together.